Hello, I am Dr. Veerendra Koujalagi. I am medical gastroenterologist practicing in Sahakar Nagar, Bengaluru at my clinic Eka Gastro and Liver Care. H. pylori. H. pylori is almost like a buzzword now. So, H. pylori is nothing but a bacteria which stays in your stomach once you are infected with it. It can be there for decades together. It can cause a lot of changes in the stomach mucosa, causing many times ulcers. Ulcers can cause bleeds, and also these ulcers can also cause prolonged ulcers and change in the mucosa. Rarely can also progress to cancer. But the prevalence of H. pylori is so widespread in India that almost half of the Indians may have H. pylori infection. But it doesn't mean that all of them end up having these grave consequences. So, very tiny portion of them develop ulcers, very tiny portion of them will complicate, and even more tinier portion will develop cancer. But is it worth neglecting? No. If you have symptoms, then it is important that you are evaluated and you are treated for it. So, how to test for H. pylori? H. pylori can be tested with H. pylori breath test. It can be tested with stool antigen. But a foolproof way of testing is getting an endoscopy done, and we can also look into the mucosal changes that have already happened and take a biopsy where we can find H. pylori bacteria. So, how do we treat it? So, there is 2-week course of antibiotics along with antacid that has to be taken, which cures in about 80 to 90% of the patients. So, in a very few percentage, about 10 to 15%, there may not be response to this treatment. Then there are second line regimens and escape regimens which are very much available, and with new antacid medications coming into the role, the success of anti-H. pylori therapy has been very high. So, are we to be afraid of H. pylori? No, but we have to be aware of it, so that whenever we have symptoms, if it is because of H. pylori, then that needs to be treated. And once for all, it will reduce the risk of so many diseases that can come along with it.